Good morning. This is Dr. McDaniel at GYN Corner. I'm a board certified obstetrician gynecologist in New York City, Midtown Manhattan, and I'm bringing to you all things health related for women. Thank you for joining me here at the corner. Please hit the like button on Facebook and please hit the subscribe button on YouTube. Follow me on Facebook. You'll get a heads up on all the presentations and when they're being presented. And please check out the podcast. It's called GYN Corner. We're on all the major platforms: Apple iTunes, Apple Podcasts, Google, Anchor, Spotify, all the usual haunts. And please leave a review to let others know why you enjoy watching GYN Corner, and that also lets me know that people appreciate the content that's being presented. Please leave messages and comments to let me know additional content or if you have questions that I can address and provide answers and hopefully helpful information. As the title presented, I'm speaking again about thyroid disorders. Today, the topic is Hashimoto's disease. Hashimoto's disease comes from a Japanese surgeon called Dr. Hashimoto. He was the first person to diagnose and to provide information on this disorder. That was in 1912, so not very long ago. And Hashimoto's is a thyroid disorder that produces underactivity of the thyroid. So hypothyroid disorder, the thyroid cannot produce the level of hormones that it needs to produce to maintain normal metabolism and normal temperature, body control. Oftentimes when someone has this disorder, they'll present with a few of the most common complaints are they've gained a lot of weight, so they've gained 20 to 30 pounds in the last 2 to 4 months. They're cold all of the time, despite others being warm or normal. They also complain of dry skin, dry brittle hair, and hair loss. The hair's falling out. A lot of the times for women, and this affects women 8 to 15 times more often than it affects men. They'll complain that their cycles are irregular. So either they're not getting menstrual cycles anymore, they've stopped getting their cycles, or their cycles are really super light. They used to be 4 to 5 days. Now they're only 2 to 3 days. And they're maybe half the amount of flow, or they're just little drops or brown smudgy, or they're just irregular. Also, a lot of women, especially, but people who have Hashimoto's will complain that they're constipated. They have bloating, constipation. They have swelling, so their face is puffy and swollen, or more commonly their legs are swollen. So it's what we call pitting edema or brawny edema. So pitting edema is you press on the shins, the front of the legs, and the skin just pushes in like dough, Pillsbury dough boy. Or brawny edema, where the legs are super swollen, they're firm, hard, and they've become discolored, so they're golden brown. Joint pain and muscular pain is very common, and then also because of the irregular cycles, difficulty getting pregnant, so infertility issues. So those are all the usual signs and symptoms of low thyroid or hypothyroidism, which is produced by Hashimoto's. And then with those presentations, the evaluation is always going to be to do a hormone panel. And that hormone panel will include the thyroid function panel, or TFTs. So that's TSH, or thyroid stimulating hormone. That's the hormone that comes from the brain. The pituitary tells the thyroid to function. That hormone will usually be elevated because the brain is working harder and harder and harder to try to get the thyroid to produce enough hormones. And because the thyroid is destroyed by the body's immune system erroneously attacking it and causing it to die off, the thyroid levels, which is T3 and T4, they'll be low. So the TSH will be high, the T3, T4 will be low. When we see that and everything else is normal on the hormone panel, then the second blood test includes antibodies, so thyroid antibodies to see or to confirm really that the body is erroneously or abnormally attacking the thyroid. Once that's confirmed, then a sonogram is often done because more than 50% of the time the thyroid will be enlarged, and that's because, as in previous presentation, the thyroid's trying to work harder and harder and harder to produce hormone levels that it can't produce because it's being destroyed. And it's like a muscle. If you pump your biceps, you do weightlifting or something, what they call arm curls, you pump your arms over and over again, that bicep will get larger and larger. Same story with the thyroid. It's working harder and harder. It's going to get either diffusely or just generally enlarged, or it'll start to be lumpy, so you'll have nodules or goiters of enlargement. So an ultrasound or a sonogram is obtained to confirm that that thyroid enlargement is not due to liquid or an abnormal looking mass. It's due to just a general enlargement or a goiter of the thyroid. So in this scenario, with the presentations, the blood tests that are done, the sonogram that confirms, then we diagnose this lady with Hashimoto's disease, and the treatment's going to be simply just to replace the thyroid hormones that the body can no longer replace to adequate levels. So that's going to be Synthroid, levothyroxine, or Armour Thyroid. Those are hormones that we can give that individual to bring the thyroid levels back up to the levels that are normal, and we call that euthyroid. Once that lady is euthyroid, then she'll be back to normal. She'll feel better, she'll start losing the weight, she'll get regular cycles, the hair will stop falling out, the swelling, the constipation will go away, the joint pain will go away, and all things being normal, she'll be able to get pregnant if she wants to get pregnant. The Hashimoto's disease at any given point in time affects 1 to 2% of Americans, and about 5% of the population at any point in their lifetime will suffer from Hashimoto's, so it's not an insignificant disorder. Hope that's been helpful information on Hashimoto's disease. If you have any questions, as I stated, please list them in the comments below on YouTube or on Facebook. Please hit the like button. Check out the other platforms of the podcast, YouTube and Facebook, and let me know that you enjoy the information I'm presenting by subscribing or hitting the follow button, and then please hit the like button. So I hope you enjoyed the presentation. I'll be back at the next presentation with more information on the thyroid disorder. Have a great rest of your day, and bye.